After reading the Fatimon text, we have determined that cultures with major differences have a difficult time working with one another. We are going to go over 4 different things. The first will be cultural relativism, the second will be inequality between cultures, the third will be ethnocentrism, and the fourth will be family values and beliefs. This book could not be written without the concept of cultural relativism, because if she had her own bias within this book, then the culture would not be understood as well for other people, because she was already within the family and really could understand all their beliefs and stuff better than someone who would not go within the culture and put their own bias in. Since the translator that Fatimon picked was already a part of Hmong culture, it was easier for her to understand what the culture was about, because the translator could explain from her experience within the culture to her, and she could explain that better within her book and within her experience with the Lee family. She got within the Lee family because of the translator, and since she got to spend so much time with the family, and since she was of a lower class, she was accepted easier within this family as well as within the culture, because she practiced cultural relativism and was willing to learn their culture before she put her own bias into whatever she did, her practices and beliefs within the culture.
So in this book, we see a huge theme of inequality, and we see this through the fact that the Lee family cannot assimilate into the culture. And because they can't assimilate, we see inequalities all across the book, such as there's a lack of communication between the doctors and the Lee family because of the language barriers. We see this also because the doctors and the Lees have different ways of treating Leah. And so we see that because of their inability to assimilate, there are inequalities in how the Lees are able to communicate with the doctors. And this is very detrimental to Leah's health. And because of this, the Lee family cannot give the medication to Leah as prescribed because of the fact that they are not able to communicate with the U.S. doctors. So inequality is a big theme in this book.
So I'll be talking about ethnocentrism, and that's using your own culture to measure another person's culture. So in the Fatimon text, we see ethnocentrism in examples of cultural superiority and tacit ethnocentrism. For cultural superiority, one of the most obvious examples in the text is both how Leah's doctors treated the Lee family and how the Lee family treated her doctors. So the doctors believe that their way of treating a patient is right. Western medicine is what they know and what they believe is the most effective. So the Lee family, they have extremely different beliefs and practices when it comes to healthcare. They also believe that their way is the right way. Shamans heal people, not doctors, in Western medicine. Tacit ethnocentrism is evident all throughout the Fatimon text as well. Signs are when a person's way of life is normal and not cultural. Animal sacrificing and placenta bearing is normal for them, even though it's strange to us. So just like it's important for the anthropologist who wrote the story to be aware of ethnocentrism and its potential pitfalls, it's just as important for us in our journeys and in everyday life to understand ethnocentrism and to learn how to avoid it, to fully understand a person and their culture.
Family values and beliefs also played a big role in the book in demonstrating how the cultures couldn't really get along together. One thing was the Hmong family, the Lee family, had very strong family values. They were devastated when the government took Leah from them, and then eventually they got her back, but that was a huge issue for them. There was a spiritual problem because they didn't agree that all of Leah's healing should be done medically like it was being done by the doctors, but they believed that there should be spiritual healing more so. They also showed huge dedication to the family because once Leah went brain dead, they took care of her for 25 years, whereas a normal American family would probably not do that. They would a lot of times pull the plug, or somebody that was brain dead would only live for a year or two. They gave her baths and fed her without a feeding tube. They were very dedicated to taking care of her and giving her the best life possible. There was also something that we noticed, kind of relating the Hmong family to the Kashmiri culture. There was cultural pride between the two. The Kashmiris didn't want to kind of assimilate to modern times with their textiles. They wanted to keep making handmade crafts. They had very special patterns that they used and stuff like that on their stuff for their businesses, but that wasn't really working for them anymore because times had changed, and they were struggling with that and whether they should have custom patterns and just use custom patterns and have machines make their products. And that was kind of like them trying to struggle whether they should assimilate or not. And the Hmong family did the same thing because they could tell that Western medicine helped with kids that they'd previously had being helped by Western medicine. But then they also wanted to maintain their culture by using shaman and having animal sacrifices, which they showed. So there was definitely a big difference there. In conclusion, we decided that based on cultural relativism, inequality, ethnocentrism, and family values and beliefs, that we could see major differences between American culture and the Hmong culture. There were differences in beliefs related to religion, and they believe in shaman healing, and we believe in doctors healing. There's huge differences there. So overall, our theory was that cultures with huge differences have a really difficult time working with one another.